I want to welcome everybody to the 2012 University of Alberta Influenza Campaign Orientation. I am extremely pleased to see everybody here again this year. This is, I have to say, I know that some other people feel a little bit differently, but for me this is one of my favorite times of the year. Everybody who's doing all the hard work is sitting over there and they're scowling at me right now. This is one of my favorite times of the year because it's an opportunity where we at University Health Center, a part of University Wellness Services, get an opportunity to get together with you as students in both the Faculty of Pharmacy and the Faculty of Nursing to undertake what I think is just absolutely fabulous opportunity on campus. And that's to provide an interdisciplinary setting for you to get together with your colleagues from other faculties, to collaborate with us, to undertake the largest influenza campaign that the university offers, and I would vouch to say one of the largest on-campus campaigns in the province. So you're going to be in for a treat this year, I hope. I know that the students, the feedback that we've received in past years when we've run the campus campaign has always been extremely positive, very positive, to the point where we get students who each year are joining the campaign, requesting to join the campaign, given the experience that you're going to get. So over the course of the 6 days that we're going to be running the campaign, our hope is to surpass what we did last year, which was a record for campus, which was over 5,000 vaccinations. So over the course of 6 days, you're going to get an opportunity to do a lot of injections. And we will try to do everything we can to give you the best experience possible and the safest experience possible to practice your skills and get an opportunity to work with patients on campus. So thank you so much. Very much appreciated. What I'd like to do is to start by just introducing our team from University Wellness Services who's going to be working with you and going to be supporting you during the campaign here. And then we'll briefly go through what we're going to be doing today for the orientation for you. So if I could just get the group to stand up here, off to the side, and turn around and face the audience. First in line, closest to me over here, is Erin Walker from our University Health Center Pharmacy located over in the bookstore. And right next to him is Beth Woitis, who is one of our registered nurses. Next to Beth is Neil. And Neil is our administrative assistant, who was the gentleman who's gone to such great lengths to get you this package. Many Bothans died to get you this information. Next to Neil, we have Melissa, another of our registered nurses. And next to Melissa, we have Mary from the pharmacy as well. So minus Neil, who he and I are the admin supports for this operation, the others, the four individuals there, are the clinic managers for these campaigns. So over the course of the main campus campaigns that we're going to go through in a few minutes, and over the course of the extended campus campaigns, those four individuals are going to be the law, essentially, when it comes to the operation of our clinics and campaigns. So they would be your go-to people if you have questions or if a concern arises, if there's an emergency, if you need supplies, or you just are lonely and would like someone to talk to. They're the people that you can go talk to. So what are we going to do today? Well, we have a few things that we're going to cover over the course of about an hour and a half or 2 hours here. My name's Kevin, by the way. I'm the Assistant Director of University Wellness Services. And we've gone through the introductions here. We're going to cover this afternoon the plans for this year's campaign, go through a little bit of information in terms of the schedule for this year and how we're going to be undertaking the campus campaign. Then we're going to cover this package, which is what we call the influenza protocol. And can't stress enough the importance of ensuring that you have read through this information, in addition to the Alberta Health Services influenza workbook that we're going to talk more about during this afternoon's presentation as well. Prior to starting the workbook and the questionnaire exam at the end of that workbook, along with this package, are the mandatories. So you have to have ensured that you've read through and understand prior to coming on to one of our campaign days. All right? We're going to go through the workbook, then we've got a bit of housekeeping that we're going to go through, and then any questions that you might have afterwards. All right? So, with regards to the campaign, we have, over the past 7, 8 years now, run this campus campaign in a number of different formats. But about 6 years ago is when we first began to bring students into the fold in terms of offering these influenza injections to our campus community. So our campaign involves stakeholders from the Faculty of Nursing, Faculty of Pharmacy, along with the university's Human Resource Services, and then University Wellness Services, with some support from the University Students' Union as well in terms of space and whatnot. Human Resource Services provides us with the administrative staff and volunteers that are going to help to support you to ensure that all of your patients have properly completed their NCR forms prior to coming in to get their injections. And then, of course, it's you and your faculties and your supervisors and those from the pharmacy community who are coming in to donate their time that are going to be the resources on the ground to ensure the success of this campaign. Our goal over the 6 days that this campaign is going to run is to reach as many students and staff as possible on campus. So our campaign reaches out into the campus community to students on campus, along with any staff members within the university community. And unfortunately, we can't reach family of students. It's something we'd like to be able to do, but just in terms of capacity, we can't do that. So we're reaching out into the community to those groups specifically. And this year, we're going to be running a total of 6 days of campaigns. So our first day is going to take place October 31st. That's a Wednesday. And October 31st is going to be the Enterprise Square location. So we'll be reaching out to students in the downtown community and offering shots right at Enterprise Square itself. The very next day, Thursday, November 1st, we're going to be out at Campus Saint-Jean and located in the Grand Salon, and using actually a group of French nursing students, or French-speaking nursing students rather, hopefully you're all here, to provide injections to the Campus Saint-Jean community. And then the following week, starting on the Tuesday, November 6th to the 9th, Tuesday through Friday, we're going to be here on main campus, the second floor of the Students' Union building, located in Dinwiddie Lounge. And we'll run the clinics over the course of 4 days for everybody on campus. Now, outside of that, in addition to the formal campaigns that you're going to be involved with, the University Health Center, which is located on the second floor of the Students' Union building, is also going to be offering influenza shots, again, free. Just a matter of coming in and getting your shots there, either at the clinic on the second floor or downstairs in the main floor of the bookstore at our pharmacy. So either location will also be offering injections free, just like the main campus and extended campus blitzes. The only proviso is that we're not going to be offering those shots during the time that your campaigns are going on, just because of how many resources it takes to put on the campaigns in general. So that's our timeline. And then after the 9th, our hope is to actually offer some booked appointments out of the pharmacy as well. So if there are staff or students who would prefer, rather than a walk-in setting, to actually book an appointment in advance, we're hoping of an online booking service set up here in the next week or so that students and staff can actually book into to come into the pharmacy and get their shots there. So these are the dates and times of the clinics and their locations as well. I would ask of you that in advance of your clinic day, please take the time to visit the site or make sure that you know where the site is, where you're going to be taking your clinics. One of the expectations we have is that on the day of our clinics, you are at the site and ready to go by the appointed time. Not coming in at that time, but ready to go, because we have a lot of information to cover. This is the pre-orientation. On the day of, there's a whole extra set of orientation that's going to take place on site, because we have to actually orient you to the site, show you where things are going to be located, how the workflow is going to take place, and so on and so forth. So please take the time to make sure that you know where your site is located and how to get there so that you can be on time for your specific day. So we're covering 4 days. 2 one-day clinics at Enterprise Square and Campus Saint-Jean. The vaccine will also be available, as I said, through the pharmacy and the health center, and it is free to all Albertans, as well as students attending the University of Alberta. All right, so Alberta Health Services is very clear that we can provide this to individuals who may not be considered Albertans per se, but if they're studying at campus or involved in a program at campus, they're still covered. So we're going to have, at our various sites, different levels of students who are going to be involved in the campaign. Campus Saint-Jean tends to be a relatively small, contained clinic. Enterprise Square would be the next largest campaign. And then our main campus blitz, the 4-day blitz, will be our largest campaign. And on any given day at the main campus campaign, as an example, we'll have over 50 of you that will be involved along with instructors. So it's a very large campaign. If you've been, how many of you have been to one of our clinics in the past? So you have a general sense of what they look like and how they operate. So it can be very chaotic on certain days depending on how many people come out. It's a lot of fun, very exciting as well. But we're going to have a lot of people there and a lot of instructors and supports for you in place as well. Last year, like I said, we did just over 5,000 shots within the campus community, and we're hoping to do that again this year. So with regards to the protocol, that's this wonderful document here. I'm not going to read through it step by step with you, but I'm going to cover some of the main points with you. The protocol covers the scope of what I've just talked about. It also goes through the core competencies that are expected of you. All right, and if you have varying levels of competencies, don't worry. We're going to cover that with you a little bit today and a little bit on the day of as well. But if you have questions or concerns, don't hesitate to come and touch base with one of, not myself, one of the clinic managers, and they can address the specifics with you to make sure that you're fully up to speed. But as I'd mentioned, more than anything else is really ensuring that you have completed the workbook. And if you have any questions, to bring those questions forward either to your instructor within your group or to the volunteers who will be helping you on the days of at the clinic, or to one of the 4 individuals that I've pointed out here as well. So we need to ensure that you're able to demonstrate administering an IM injection, that you're able to take basic patient history, and the NCR is pretty good at walking you through that step by step. Basic patient assessment skills, and that you've completed your first aid and your healthcare provider CPR, all right, which I know for most of you that's a given with the work that you're doing. So, as well, located in the protocol is an outline of the supplies that will be provided to you for your clinics, and the supplies are the same regardless of the site that we're going to be going out to. So be sure to take the time to familiarize yourself with what we're going to have for you on site, and be familiar with the specific supplies that we'll be using. We are going to have regular non-retractable safety needles. Okay, so this year Alberta Health is fully rolling out Flu Mist. Some of you may be familiar with that. They were testing it last year out in St. Albert and at a couple of test sites. Flu Mist is now available to the community at large, but for our purposes, we will be using the regular vaccine with needle. Okay, and they're not retractable needles, so you're going to get a lot of experience in using needles that still have the safety feature built in, and we're going to walk through how to go about using those needles safely and making sure that they're disposed of safely. We're going to be using 10-dose vials of the vaccine, so we'll be doing draws off of 10-dose vials. So that's going to involve specific storage requirements, cold chain requirements. We're going to go through all of that with you as well. On site, we will have a first aid kit as well as 2 anaphylactic kits. And on the day of, you will receive specific instruction on where those are going to be located, such that if an emergency does arise, you're able to know exactly where you need to go to get the materials that you're going to need to deal with that particular situation. Band-Aids and alcohol will be there as well, and hand sanitizer on site, because again, we want to ensure, in addition to the water source that will be available for you to be able to wash your hands after, is it every 8th injection, every 10th injection? That you're actually washing your hands with soap and water, but in between we'll have hand sanitizer located at each of your stations as well, so that you're able to sanitize yourself. So only 1 syringe size that we'll be using. and the SureGuard safety hypodermic needle, and you will be responsible for assembling the needles and the syringe. One of the questions that we've had on occasion in the past when it comes to using the syringes is, can we assist each other if we're not busy in pre-filling syringes? And the answer is? Exactly. See, you're halfway there already. In terms of the emergency protocol, that also is covered in this document. So again, want to ensure that you've taken the time to read through it in advance. The number one priority, obviously, is the safety of your patient. But we do ask that you ensure that the site nurse or the site pharmacist, as the case may be, is immediately made aware of the emergency or the potential emergency. All right? Again, they are the people on site to deal with that situation. Registered nurses, certified pharmacists, they're the people to turn to if there's an issue that needs to be addressed. So please make sure that they're aware. On campus, using your cell phone, or there are payphones in the Students' Union building, although not up on the second floor, 911 will get you connected to emergency services, obviously. One of the things we ask is if you or somebody else in your group is going to be contacting 911, that you let them know right away that you are calling from the second floor of the Students' Union building on campus and that you need to be connected with University of Alberta Protective Services. All right? The community emergency system does have a process in place that they can patch Protective Services in on that call to ensure that Protective Services meets the EMS group on campus to direct them into the Students' Union building. If we don't do that, then the potential exists that the ambulance or Protective Services is riding around trying to find the exact address using GPS, and that doesn't always work so well. So it's easiest if they can meet Protective Services and get driven in right to the site. So obviously ensure the safety of your patients, follow your training, assess the conditions of the patient, and commence anaphylactic treatment or first aid if it's appropriate and if it's required, and ensure that any other patients in the area are removed from the immediate vicinity. Right? Pretty straightforward, but again, there's nothing worse than having someone that faints on you and all of a sudden the 4 or 5 people in the surrounding area are all dropping because they all were nervous to begin with and they just saw their best friend go down, right? So best thing you can do is to ensure the safety of your patients. There's sometimes an automatic response to go help. Again, let the clinic managers know that assistance is required and only help if it's safe to do so, but don't forget your own patients if you have one with you. Okay? On site, we will have some mats available. Essentially, they're like a yoga mat that will be set aside with a privacy barrier in place at each of the sites, such that if your patient seems nervous, maybe needs to lay down before you're doing your injection, you can do that. And that privacy area will be fully equipped with a sharps container and all of the supplies you're going to need to be able to do that shot there. All right? Same thing if somebody comes in who is wearing a sweater or a long sleeve shirt or whatever and needs to lift their sleeve or lift their sweater or whatnot, those privacy rooms are available for you to use as well. Any questions around that? All right. In terms of needle sticks, it's not going to happen, right? Nope. All right. If a needle stick should occur, there is a protocol to be followed for the needle sticks. And again, it's covered in brief here. We want to ensure that your sharps container is always within reach of your workstation. That's number one. Early on in the clinics, when we were first doing these, we had situations arise where students were taking their sharps container with them when they were going to the privacy areas, or in some instances, if they were moving around a little bit to assist a patient, their sharps container might be at the other end of their workstation. And the end result was there were situations where people were reaching, or they might stumble, while they were moving with a needle, and the end result was there's always the potential for a needle stick. So in the years that we've run it, we've had, I think, 1 needle stick that we've actually had to deal with. We don't want that to happen this year, so we want you to be safe. And so please make sure that you always have easy access and reach to all of your equipment, including the sharps container. and that you're taking your time with your shots, obviously, when you're going through them. If you do need to take a sharps container to an alternate location, please bring it with you and obviously transport it carefully. That means no running from one location to another and whatnot. And as soon as you're done with your shot, immediately dispose of your needle. Make sure that it's secured and locked so that you can't stick yourself, and then dispose of it in the container. And on the day of, we're going to walk through the process and protocol for full containers on how to dispose of those full containers and get a new one for yourself. If a needle stick occurs, we want to ensure that you let it bleed freely. So not a lot of patting and rubbing and whatnot. Let it bleed freely. Wash it well with soap and water, and there will be a water source at each of the sites that we're going to be located at, and you'll be shown as to where that is. Or use an alcohol-based rub, and we will provide that at each of your workstations as well. And cover the area with a dry dressing. Again, as soon as it's safe to do so, let your clinic manager know so that they can assist you and help to support you through that. You want to make sure that once you've taken care of those steps, that you report the incident to your clinic manager and seek medical attention at the health center. Okay? During the day, it's at the University Health Center located in the second floor of the Students' Union building. For main campus splits, it's a non-issue because it's right down the hall. For the other sites, you're going to be coming back to main campus to attend the University Health Center. We want to ensure as well that you report the incident to the Office of Environmental Health and Safety on campus, and we will have information and the bloodborne pathogen exposure information located at each of the sites as well. So we'll have that protocol there for you should we need to step in and assist you with that. And in complete a workers' compensation board report and submit that as well. Again, those forms are located on the Environmental Health and Safety website. We will ensure that we have that information available to you as well in case it's needed. But we're not going to need it, so it's going to be okay. So each site is different. Each site is different size, different location and whatnot. I wanted to just give you a general sense of what the main campus site looks like, because regardless of your site, the workflow is generally the same. So in the Dinwiddie Lounge, for instance, we've got the main entrance of the lounge, and that's where students or staff members on campus are going to be bringing their NCR form once it's completed. But the registration for our clinics, as many of you will know, is actually located down on the main floor of the Students' Union building in the main thoroughfare. So when it comes to registration, we're going to be breaking you up into groups for the day. Each of your groups or each of your pods is going to have an opportunity to rotate through the various aspects of the clinic. So you're going to get a lot of time doing injections, and you're also going to get an opportunity to do some pre-care work, so doing some basic history work with patients, answering questions about the influenza vaccine, educating people, making sure that their NCR is appropriately completed and filled out. You're also going to get an opportunity at the back end in the post-care area to ensure that you're overseeing patients, monitoring them for health, answering any questions they have about aftercare and so on and so forth. The NCRs located down the main floor are going to be distributed and completed by our Human Resource Services volunteers who have graciously agreed to come over and help to support you from an administrative perspective. So your group, when you're located or when you rotate through that main floor area, is going to be very much one of supporting patients and answering questions around, well, what does it mean? Why is it important if I have an egg allergy? I'm not feeling well this week, or I'm pregnant, and all those questions that come up. You will be that health resource for them to be able to answer those questions. And it's vital that you're not just there for them to approach, but that you're actively approaching them, getting out into the lineup if there's a lineup, answering questions right in the line. If there's time where they're filling out their forms and then they're waiting to get it checked and completed, that you can actually have a chance to take that form and double check it for them and make sure that you've answered any questions that they have. Once that's done, patients are going to come upstairs. If it's one of the extended sites, the registration is located immediately outside of the clinic room, and they'll complete their information there and then proceed directly inside. But regardless, they're going to end up at the front receiving area of the clinic, and we will have an area just inside the doors where people can sit down if there's going to be any kind of a wait. For most of our clinics last year, off-peak, the wait times tended to be anywhere between no time to about 6 minutes. During our peak periods, on the main campus clinic, for instance, Tuesday to Thursday, the average wait time was anywhere between 8 to 12 minutes. On Friday, when everybody decided to come out together, it was 2 hours. So, when you're talking to your friends, when you're talking to your classmates, when you're promoting this to everybody else, we're taking some steps here this year to try to do a bit of a different marketing approach to really encourage people to come on any day except Friday. But please, word of mouth is the best way to let people know. Tell them, come anytime between Tuesday and Thursday. You're going to get in right away. There's virtually no wait time during the majority of the day. But that Friday tends to be the day. If you want to hang out and just hang with your friends, come Friday. You'll have 2 hours to hang out with your friends before you get your shot. So we do have chairs set up to accommodate those busier periods during the day. We're going to have, generally on any given day, roughly 36 stations set up for people to access, so the flow through is relatively quick for people to get through the system. We'll have an injections area set up, so people will come in through the chairs to the injections area once a station opens up. And once that's done, and you've done the injection and you're going out the other end, patients will have a post-injection area where they're going to wait until they're done. And in the case of this clinic, they then go back out the back doors here. So you can see we try not to have people looping back on each other and getting stuck in a traffic jam. We try to keep the flow as simple as possible, and we will have some spots available for privacy screens, as I'd mentioned before. So I'm going to hand it over to Aaron, who's then now going to go through the workbook with you and spend some of the time. And then after that, Beth is going to cover some of the back-end stuff here. So stay tuned just for a moment.
Where's your platform? Aha. Can everyone hear me? Hello? Can everyone hear me? Is that all right? All right. So as Kevin mentioned, my name is Aaron. I am one of the pharmacists down at the University Health Center Pharmacy in the bookstore. I'm going to apologize a little bit off the top. My job today is to kind of briefly review the Alberta Health Services workbook that I believe your instructors have either provided you a link to or provided you a hard copy of. That's the workbook that needs to be completed. You need to review before the clinic. In order for us to provide this learning opportunity for you and this excellent health initiative on campus, we have to make sure certain requirements are fulfilled. So last year we actually had the students attend an Alberta Health Services orientation in addition to this orientation, and there was a lot of redundancy. There is going to be some redundancy this year with this presentation, but hopefully with us bringing the summary of the Alberta Health Services orientation to you, it's a little bit less redundant. All right. So I'm just going to quickly go through some of the basics. So what is influenza? Seasonal influenza. Not to be confused with the common cold or stomach flu, diarrhea, vomiting, nausea, vomiting. In order to provide clarity, I'm going to do my best to refer to it as influenza and not the flu. And I think all of us will try to do that, all the people that are involved with the clinic. Just reduces a little bit of confusion so that we know that we're talking about seasonal influenza, which is a viral infection that affects primarily the respiratory system. There are three strains of influenza which can cause illness. The A and the B strain are the strains that typically cause seasonal influenza. I'm going to have to just call it influenza. And the A and B strains are the strains that are included in the vaccine each year. There is a third strain, a C strain, which usually only causes mild respiratory illness and is never included in the vaccine. Some of the signs and symptoms of influenza. First of all, influenza circulates primarily in the winter months, so that in the northern hemisphere is December through March. That's the peak time for seasonal influenza to occur. But we do see cases as early as October, so that's when the vaccine is normally rolled out. The symptoms are usually of sudden onset. They include headache, chills, cough, followed by fever, maybe some loss of appetite, muscle aches, and fatigue. If anyone's ever had influenza, fatigue is a big symptom, and that's a pretty good indicator that it is seasonal influenza. It may also cause runny nose, sneezing, watery eyes, or even sore throat. Rarely, but occasionally, nausea, vomiting, and maybe even diarrhea occur, but that's more common in children. As far as complications go, a normal healthy individual who suffers from influenza will recover, usually within 10 to 14 days. It's not a pleasant experience, but it is something you can get through relatively unscathed. However, influenza causes approximately 20,000 hospitalizations a year and 4,000 deaths in Canada that are directly associated with influenza. That's not the indirect causes, such as dehydration and those sorts of things, or exacerbation of an underlying medical condition. Those are the directly caused by the influenza virus. There are high-risk populations who are more likely to suffer from these complications, and some of these high-risk populations are young children from the ages of 6 months up to 5 years old, people over the age of 65, pregnant women, people with underlying chronic health conditions such as hypertension, diabetes, asthma, Aboriginal peoples, and people who are morbidly obese with a body mass index over 40. Those have been added to the high-risk category this year as well. Some of the complications that can happen from influenza are secondary pneumonia. So the respiratory illness turns into a secondary pneumonia, which can be caused either by a viral infection or bacterial infection. It can develop into an ear or sinus infection, dehydration, but the most common cause of hospitalizations and death is exacerbation of an underlying chronic medical condition. So on to how influenza is spread. Influenza is spread directly as well as indirectly. So directly, that's mainly through person-to-person contact with the contaminated water droplets. So people sneezing, people speaking with spittle or whatever you talk when you spit when you talk, that kind of stuff. Water droplets in the air is the most common form of direct transmission from person to person. It can also be spread indirectly. So contamination of surfaces, work surfaces such as phones, mouses, keyboards, those sorts of things, especially in shared work environments. So contaminated surfaces with those water droplets I was speaking of, someone then touches them and then touches their eyes or their nose or their mouth. That's an indirect way of getting influenza. The incubation period of influenza is 1 to 4 days. And so the incubation period means basically that's the time that it takes your body to show symptoms of illness. So you may not be sick for 1 to 4 days, although you have influenza. So that speaks to how easily it's transmitted. You're going to have people out and doing their normal day-to-day activities for 1 to 4 days before they start showing symptoms. Hopefully once they start showing symptoms, they start taking precautions such as not going to school or work. However, for the first 1 to 4 days when they weren't aware they were sick, they are spreading the virus to others. Okay, so it is likely to be spread to others during that incubation period as opposed to when you are ill. Okay, so you are contagious through the incubation period and for anywhere between 5 to 7 days after symptoms have started. Okay, in some people who have a compromised immune system and aren't able to fight it as quickly, that 7 days may turn into 10 days. Okay, so prevention of influenza, seasonal influenza. Obviously, the number one way to prevent seasonal influenza is the reason we're here. So that's annual influenza vaccination. So the vaccine effects last less than 1 year, the seasonal influenza vaccine. So that's one reason why it's important that everyone is vaccinated, or that it's recommended that everyone is vaccinated every year. Another reason, can someone tell me another reason why vaccination yearly is recommended? Sorry? Yeah, the World Health Organization determines a different series of 3 strains that are going to be incorporated into the vaccine each year. So not only does the vaccine not last from year to year, it is different year to year, okay? So other than vaccination, other important preventative steps are proper hand washing technique, so using non-bacterial soap and rubbing vigorously for 15 seconds or longer to make sure that your hands are washed, rinsing them under running water and cleaning them or drying them with a clean or disposable towel. Covering your cough or sneeze with your elbow or with your hands and then washing your hands afterwards. If you are ill and you suspect it's influenza, stay home from school or work so you don't spread it to your classmates or coworkers. As I said, it gets in the body through primarily your eyes, nose, and your mouth, so avoid touching those areas through the day. Stay healthy, exercise, hydrate, stay rested, avoid smoking, eat well. If you know that influenza is circulating in your area, try to avoid crowds if at all possible. Frequently wipe down public work surfaces such as mice, keyboards, phones, those sorts of things, especially if you're using other people's items or if it's a shared workspace. And if you don't have access to hand washing frequently, using alcohol-based hand sanitizers is important. And washing your hands before you eat or drink. Occasionally we see people, especially in the healthcare field, where prevention is also achieved through taking an antiviral medication. Mainly we see that with people who work in a institution where influenza is circulating and for some reason that staff member is not able to be vaccinated, but they need to continue working. They may be prescribed antivirals as a preventative measure throughout the influenza outbreak. So sometimes we'll see antivirals in the form of prevention, but more oftenly we see antivirals used in treatment. So we'll go on to treatment now. Like I said, for most healthy individuals, seasonal influenza is easily survived and it's uncomfortable, but usually the treatment just consists of rest, hydration, and just symptomatic treatment of your symptoms. So if you have a fever, you're taking Tylenol or an antipyretic to manage your fever. If you have muscle aches and pains, again, Tylenol to help with those symptoms as well. And again, rest is the most important thing. And then we do see antivirals as well used in treatment of the influenza virus. However, antivirals have a couple drawbacks. First of all, if you don't have any sort of insurance coverage, they can be expensive. Second of all, they need to be started promptly. They need to be started within 48 hours of the onset of your symptoms. So a lot of times, by the time people realize, okay, I'm really sick, they're 3 to 4 days into it, and it's likely not going to be effective at that point anyway. So we're going to move on to talk, does anyone have any questions about influenza itself? Okay, we're going to move on to the vaccine. So as I mentioned, the vaccine is different every year, and the strains that are included in the vaccine each year are determined by the World Health Organization. The World Health Organization has a lot of people that are a lot smarter than me who determine what vaccines are going to be put in the vaccine each year, and that's determined based on how virulent or how much illness is caused by a particular strain, as well as how predominantly it's spread and how its prevalence throughout the area, or what they're anticipating its prevalence to be for that season. This year's strains, each year the vaccine contains 3 strains, 2 A strains and 1 B strain. This year there is going to be, the 2 A strains are going to be the California H1N1 strain, as well as the Victoria H3N2 strain. So these are strains that we do want you to talk to the patients about, and you might get a lot of blank stares when you are telling them the names of these strains, but this is part of the informed consent procedure. So the way I talk about them is the California H1N1 pandemic-like strain. So this is the same strain that was included in the H1N1 pandemic vaccine, and it's also been included in the two or three vaccines since then. It's been included yearly, each year since then, in the seasonal influenza vaccine. The other A strain is the Victoria H3N2 strain, and then the B strain is the Wisconsin strain. In Canada this year, there's actually going to be 8 different influenza vaccines on the market. Okay? All of the vaccines protect against the same 3 strains. Okay? They're just made by different companies and they have their own different claims to fame. As Kevin mentioned, Alberta has a universal influenza immunization program where they will pay for the vaccine to be provided to people who live in Alberta or work or study in Alberta during the influenza season. The government of Alberta is using 3 of those 8 vaccines. The 2 injections are the trivalent inactivated vaccine. So you may see on the slide, it'll have the abbreviation later on, TIV, TIV, for trivalent influenza vaccine. Those are the injections, okay? So there's two of those. There's Fluviral, which is the multi-dose vial, probably the one that we'll be using. It's the one we've been using in the past. And then there's another one called AgriFlu, which is made by a different company, but it's available in pre-filled syringes, which is nice and convenient, but it takes up a lot of storage space, especially when you're anticipating 5,000 doses going through your fridge, okay? These are killed virus vaccines, so there is no live influenza virus in the vaccine, so you cannot get influenza from the flu shot, okay? The third vaccine available through the Alberta government program this year is the live attenuated influenza vaccine, which is also called FluMist. That's the nasal spray that Kevin alluded to earlier. It is actually, well, it's not an injection. It's going to be provided in the form of a nasal spray, and it's provided predominantly this year to the ages of 2 years old to 17 years old. That is the target audience that the government wants to deliver the vaccine to in the nasal spray form for two reasons. First of all, they're hoping that uptake will be increased. You're going to have a lot of kids that are going to be really happy that they don't have to get poked in the arm to get the vaccine this year. As well, it has been shown in this population for kids 2 to 17 years old with a healthy immune system to be more immunogenic, meaning it has a better response. Okay? So that virus or that vaccine is going to be predominantly used for those populations. But if we do run into people at our clinic that ask about the nasal spray and want to have it administered, we simply tell them that it's not going to be offered at our clinic this year. It is available through public health. It'll also be available in the health center pharmacy downstairs in the bookstore. But we have to make sure that there's additional screening questions that they have to go through. Not everyone that's eligible for the injectable form of vaccine will be eligible for the nasal spray form of the vaccine. Okay? So although it is a live virus, I'm still talking about the nasal spray right now. Although it is a live virus, it is attenuated, meaning that it's weakened, so it's not going to cause infection. As well, it's what's called temperature sensitive and cold adapted, meaning that it's designed to replicate the virus in your nasopharynx or in the after you spray it in the nose. The virus will replicate there and simulate the flu locally. But if it gets into the lower airways and the lungs where severe illness usually occurs, it doesn't survive in those warmer temperatures. Okay? So you cannot get the influenza from the flu spray either. Okay? So on to effectiveness of the influenza vaccine. Okay, and from this point on, I'm going to be talking about the trivalent influenza vaccine. I'm not going to talk about the nasal spray anymore. Okay? It does take 2 weeks for immunity to be achieved after vaccination, so that's something that we need to inform our patients of after their or when we're giving them informed consent, is that the vaccine does take 2 weeks to become effective. They're not going to walk out of Dinwoody or whatever clinic they're at not able to get the flu. Okay? The effectiveness of the vaccine also depends on two other factors. It depends on the World Health Organization's best guess. So did they get a good match? Did they guess the right 3 strains this year? As well, the other factor is the recipient's immune system. So if you have someone who with a really strong immune system, they're going to have a better immune response than someone with a weaker immune system. So healthy individuals, strong immune system, and if the World Health Organization has made a good match, we're looking at up to 90% effectiveness, 70 to 90% effectiveness at preventing influenza illness versus people who are not vaccinated. So that's a good match. If you have a frail or elderly person with a weakened immune system, even though there is a good match, their effectiveness drops down to 30 to 40%. But we don't want you to get hung up on the numbers because although the 30-40% prevention of illness is the correct statistic, it has been shown to reduce death by 85% in that population, and it reduces hospitalization due to complications up to 50 to 60%. So even if you have someone who has a weaker immune system, or if the World Health Organization didn't make the correct guess this year, we're still looking at a reduction in complications. And also, if you do get sick, your chances are, if you are infected with the influenza virus, your illness is going to be milder and probably shorter as well. So there is some cross reactions. Even though they may not have guessed the right strains, it is still going to provide protection. On to eligibility for Alberta's influenza immunization program. So all Albertans aged 6 months and up are encouraged by the government of Alberta to be vaccinated, and that's why they've rolled out this universal influenza immunization program, and they're providing the vaccine free of charge to all Albertans or people studying in Alberta. As Kevin mentioned, for our purposes, we are going to be targeting staff of the university and students of the university only, okay? Not their friends, not their family, just staff and students. So we want to make sure that they have a valid one card in order to be vaccinated. If they don't have a valid one card, there's no way of proving that they're studying or working in Alberta during the seasonal influenza season. We do request that they bring an Alberta healthcare card, but it's not necessary. It is nice for tracking purposes, but if they don't have it, we're not going to refuse vaccination. But they do have to have their one card in order to register. But we also need to make them aware if they aren't eligible to take part in our clinic, they may be eligible to receive the Alberta vaccination. So we have to make sure that they're aware of where the resources where they can find a publicly funded clinic. So they can go to Alberta Health Link, which the number is up on the screen there, and we'll also have that on all the registration sheets. And they can also go to albertahealthservices.ca to find a local public health clinic for themselves. All right, so moving on to who should not receive the vaccine or potentially not receive the vaccine. The first thing we're going to be discussing is egg allergies. So if you're allergic to eggs, can you receive the influenza vaccine in injection form? Yes, no, yes, no. You're both right. It depends on what the allergy is, bottom line. So in the past, before last year, I think if someone came up and said they're allergic to eggs, the vaccine would not have been provided to them. Starting last year, there's a bit more of a screening process for people who are egg allergic, so we need to drill down and ask them a few more questions. Keep in mind for the nasal spray, egg allergy still is a contraindication for vaccination, but for the injection, if they don't have any true like I can't even say seasonal influenza, I'm not going to say immunoglobulin mediated allergy, which means a rash or anaphylactic type reaction where they get swollen throat, swollen tongue, those sorts of things, itchy skin. If it's not an IG mediated allergy, they still may receive the vaccine. So if they say I have an egg allergy and you say what happens, well I get diarrhea or it makes my stomach hurt, they can still get the vaccine, okay, for our purposes at our clinic. If they do have symptoms after eating eggs of hives or rash, swollen throat, swollen tongue, difficulty breathing, shock or anaphylaxis, or if they have poorly controlled asthma, we're going to tell them that they're not suitable for vaccination. Okay? One thing is if they do say they're egg allergic, and even if it's just nausea, we do want them to be informed that they can have the vaccine, but we're going to get them to wait for 30 minutes as opposed to 15 minutes after vaccination. That's what the guidelines stipulate this year. So what if you come to our flu influenza campaign clinic and you have a fever? Can you be vaccinated that day? No? Chances are if you're healthy enough to show up to the clinic and stand in line, and although the line is not very long, if you're healthy enough to show up, your febrile illness probably isn't severe enough to prevent you from getting the vaccine. They do serious acute febrile illness is a contraindication, but if they have a mild fever, if they're feeling well enough to be attending the clinic, chances are they can receive the vaccine. But there's never a harm in waiting. If you're ever on the fence and you're not sure, if they do have a fever, we will have Tempodots on site. We can take their temperature. If their fever is high, we may ask them just to wait until they're feeling a little bit better. But just having a fever in itself is no longer a contraindication for receiving the vaccine. Just a note about donating blood. If you are planning on donating blood, you cannot donate blood for 48 hours after receiving the influenza vaccine in needle form. If you are pregnant, although the year of 2009, I think, when we had the H1N1 pandemic, there was some controversy about it. Being pregnant is no longer a contraindication for receiving the trivalent inactivated vaccine, so the injection. Being pregnant is no longer a contraindication, so we will welcome pregnant women in to the clinic to be vaccinated. The nasal spray is contraindicated for pregnant women. Okay? Breastfeeding women are fine as well for the injection. going to talk about a couple of really long name syndromes here. So oculorespiratory syndrome, I'm going to go into that in a bit more detail. But in terms of who should not be immunized, if someone has been diagnosed with oculorespiratory syndrome after receiving a previous influenza vaccine, we want you to notify the clinic managers or the clinic supervisors to make sure that it's safe to give them the vaccine this time. I think the next slide might be that flow chart. Yeah, we'll go through, the clinic managers will go through this algorithm with them to make sure that if they had an ORS reaction in the past and it wasn't very serious, they may still be able to get the vaccine. But this is something you'll refer if they, most people aren't going to know what you're talking about when you say oculorespiratory syndrome, but if they have had it in the past, they will recognize it, and then we want you to refer them to us to make sure that it's going to be safe for them to receive the vaccine. Okay? The other syndrome is Guillain-Barré syndrome, and there's a lot of different ways of saying that. GBS is the easiest way of saying it. So if they've been diagnosed with GBS, and again, someone who's never been diagnosed with GBS is not going to know what it is. But if they have been diagnosed with GBS within 6 months of a previous influenza vaccine, they are not to be vaccinated. Okay? That guideline was changed this year. It used to be within 8 weeks, but now it's within 6 weeks. All right, so moving on to handling of the vaccine. So the vaccine, majority of the time, is going to be handled by the clinic managers. So we will make sure that it's stored overnight appropriately. We'll make sure it gets to the clinic appropriately and that on-site it's stored appropriately. But when you are at your vaccination station, you will have the vial, the one vial that you are responsible for while you're at your vaccination station. So during that time, you have to keep in mind that the vaccine is temperature sensitive. We need to maintain a cold chain. And if you don't know what maintaining a cold chain is, you're going to hear a lot about it in your future profession. So basically, maintaining cold chain is making sure that the vaccine stays within its recommended temperature range. And for the influenza vaccine we're dealing with, that's between +2 and +8 degrees Celsius. And the cold chain is the term used to encompass the whole procedure and all the equipment we use to make sure that that guideline is adhered to. So you will have a cooler at each vaccination station. Each person will have their own vial in their own cooler at their vaccination station. That cooler will be packed with ice as well as temperature probes that are alarmed, and they will go off if the temperature goes outside of that range. So you'll be responsible for monitoring that while you're at the vaccination station. And the vaccine is light sensitive as well, meaning that repeated and prolonged exposure to light will make the vaccine less effective. So due to the light sensitivity and temperature sensitivity, it's important that you keep in mind that the vaccine should be taken out of the cooler and out of its box just immediately prior to drawing it up for administration, and it should be replaced into its original container, which is the box, and back in the cooler as soon as possible after administering the vaccine. Okay, as far as vaccine administration goes, there's three parts to vaccine administration. The first one is the client interview, or the fit to immunize assessment. That will actually be done twice at our clinic. We've talked about the pre-care station and the registration table. You will be expected to work in the pre-care area for a portion of the day, and while you're down there, you'll be screening patients while they're there. So they will be pre-screened at registration, where we basically make sure we ask them the right questions to determine that they're fit to receive the vaccine that day. They will also be screened at the vaccination station. So that's kind of a double check that we're using, and we used it last year as well. Despite that, we did have some patients come up to us at the end of the day and said, you know, I was never asked if I have an egg allergy the whole time I stood in line or anything like that. So we want to make sure that we are diligent and screening these people to make sure they are fit to receive the vaccine. Okay? And the fit to immunize assessment does include a brief medical history, like Kevin mentioned. We'll ask them about their previous allergies, if they're feeling well today, if they've had a previous reaction to an influenza vaccine in the past, if they're a healthcare worker, if they're exposed to people with compromised immune system. There are different screening questions for the different influenza vaccine. So Beth has tailored the screening questions that we'll be using at our clinic to the trivalent influenza vaccine, which is the injection. We've left out some of the questions that are going to be used to screen for the nasal spray, just because there's more screening questions because it is a live vaccine. So we're only going to be screening for the trivalent influenza vaccine. Okay? The second part of vaccine administration is informed consent. It's extremely important that we obtain informed consent, and this will be done at the vaccination station. This is obtained from each patient prior to them receiving the vaccine. And informed consent must include the following. Their eligibility, which will have been likely addressed by this point, make sure they live, work, or go to school in Alberta. We have to review the risks of influenza, the illness itself, so talk about what the symptoms are, its complications, why it's a problem. We include vaccine information, what the vaccine is. It's an injection that you are receiving into the deltoid muscle of your arm, and what it contains. It contains 3 strains, the 2A strains and the B strain that you'll go through. We have to include the risks and the benefits of vaccination, as well as some of the potential side effects of the vaccine. We'll give them we'll give them aftercare instructions, and we give those aftercare instructions basically in the form of a tear-off sheet, which is their vaccination record. The aftercare instructions are on the back. So basically what they can do if they feel that they're having an adverse reaction and they want to ask some questions, there's phone numbers there that they can refer to. On that aftercare sheet, it'll go through some of the reactions that are normal, what to expect, those sorts of things. We want to make sure that they're aware of the 15-minute after vaccination wait period and the rationale behind it. And we want to make sure that we've addressed any of their questions or concerns before we administer the vaccine. And the last thing we do before we poke them is that we affirm verbal consent. So after everything I've told you, do you still want to get the vaccine? We don't word it that way. Do I have your consent to administer the vaccine today? Okay, so I just want to make sure that they understand that you're asking their permission again. Okay? The actual injection process or the administration of the vaccine will be the major focus of the clinic day orientation, okay, which will be the morning of the clinic. So make sure you have read the workbook like we've already driven home a couple times, including the vaccine administration procedure. And as part of your core competencies, we have asked that you must have given at least 1 intramuscular injection before attending the clinic the day of. Okay? Any questions on vaccine administration? Okay. So moving on to some possible reactions from the trivalent influenza vaccination. Okay? So with any killed virus vaccine, we have common reactions. Can someone tell me some of the common reactions that you'd get after an injection of a vaccine? Sore arm, redness at the injection site. There's an immune response that some people get as well. So injection site redness is normal, swelling or pain at the injection site. It is normal to have a bit of a mild immune response, which can include fatigue, headache, muscle aches, maybe a low-grade fever, maybe some chills. That is not because you got influenza from the influenza vaccine, okay? That's an immune response, and it's very mild typically, and it usually lasts between 1 to 2 days after vaccination, okay? As far as managing those reactions, if they have a sore pain or soreness at the injection site, they can manage that with a cool compress on the arm a few times a day while their arm is bothering them. They can also manage it with Tylenol or acetaminophen for pain. If they are having other symptoms such as fatigue, tiredness, chills, fever, that can be managed with rest, as well as if they need to for their fever or aches and pains, Tylenol for that as well. We don't want to recommend too much other than Tylenol for managing influenza vaccine reactions, just because we might see some people that are under the age of 18 as university students, and children under the age of 18 should not take ASA due to its risk of Reye's syndrome. Okay, and ibuprofen or Advil, although it's well tolerated in the general population, it does have some contraindications that might affect some of the patients that we're going to be seeing. So Tylenol or acetaminophen is a better recommendation for management of those symptoms. So we'll move on to some of the rare or less frequent reactions with the influenza vaccine. The first one is syncope or fainting. Of the 4 reactions that I'll be talking about today, this is one that we'll likely run into a little bit throughout the course of our campaign. Okay, so syncope, although it isn't a very common reaction, it does happen. Some of the signs and symptoms of syncope or fainting include some of these symptoms we'll be able to observe. We'll be able to sit across from the person and see that they're having difficulty and that they might be fainting. Some of them we'll either have to rely on the patient's feedback or ask them questions to find out if they're suffering from them. But paleness, they might have an ashen face, sweating, they might start yawning, ringing of the ears. If someone just starts yawning, don't call for a crash mat right away. They just might be tired. But yawning is one of the symptoms that we sometimes can see before someone faints. They might complain of ringing of the ears, nausea, lightheadedness, visual changes. They might say they're seeing spots. And the last step is losing consciousness or fainting. Okay? Can anyone tell me what the number one priority when managing fainters is? Make sure they don't fall. Prevent a secondary injury, okay? Syncope or fainting is a self-limiting condition, meaning it'll go away on its own. It's very temporary and it's very harmless. It's scary for us, especially if you've never encountered it before, but it is not too uncommon. It's kind of common. We will see it, and it will go away on its own, okay? And it's harmless. However, we want to make sure that they don't fall and hit their head or injure themselves. So if you see someone going through some of the symptoms or the series of symptoms that I listed, you're going to want to be proactive. You know, you can ask them if they're feeling okay. If you have time, you can ask them if they want to lay down on the floor. We have crash mats there, which are like those yoga mats that we'll have. If they want, they can lay directly on the floor if you don't think they have time to get a mat, or they can lay on the mat and then have their feet elevated up on a chair so that they maintain their blood flow. If you need to get help from a classmate or someone nearby, an instructor or one of the clinic managers, that's perfectly fine. Don't raise an alarm. Stay calm, okay? We don't want people in the waiting area to hear a commotion. We don't want to see someone that's just about to get poked, see someone freaking out because someone's going to lose consciousness next to them. So we want to stay calm. Again, it's a self-limiting condition, okay? In some cases, fainting is predictable. You're going to get someone coming up to you and say, you know, just so you know, last time I had the flu shot, I passed out. If that's the case, we can prevent it, potentially, okay? You want to make sure that you stay calm and you're not nervous. If you're too nervous, they're going to be pretty nervous as well. If you're quite confident, or if they're quite confident they're going to faint, then we can go to the privacy area where they can lay down to have the vaccine administered, okay? But it's not always preventable. You might get a big burly football player come in and he's never had a reaction at all and he's fine with vaccines. You know, keep an eye out, always keep an eye out. The big guys go down too. It is caused by a reflex, so it's a lot of times there's embarrassment associated with it. People feel kind of silly. That's another reason we want to stay calm and not raise a big alarm. They feel silly. They feel a little bit embarrassed when that happens and a fuss needs to be made about them. But you just you know, console them. It's a reflex reaction. There's nothing you can do to prevent it if it's going to happen. Okay. The next rare reaction is anaphylaxis. And of the 4 reactions we see here, the one that we really don't want to see is anaphylaxis, okay? But of the 4 reactions here, this is probably the one that we're most prepared for, the most prepared to handle, okay? We go through great pains in making sure that we have everything in place so that if anaphylaxis does occur at our clinic, we can manage it the best we possibly can, okay? Can anyone tell me some of the signs and symptoms of anaphylaxis? Swollen throat? I heard swollen throat. Sorry? I'm sorry, I missed that. Cyanosis, discoloration, yeah, loss of oxygen, that's right as well. A lot of the signs and symptoms can mimic the symptoms that we just went through for fainting, okay? So you might see someone who's becoming pale, they're getting quite sweaty, those sorts of things. The main difference, there's 2 differences between anaphylaxis and fainting, aside from the obvious. When it's happening, syncope or fainting happens quite quickly, usually within either right before the vaccine is given or usually within seconds or moments after it's given, usually before they make their way over to the waiting period. Whereas anaphylaxis usually takes up to 15 minutes to get started, so that's why we have them wait for 15 minutes. So it's more likely to occur once they've left the vaccination station, and it's going to happen in the waiting area. Okay? Some of the symptoms, like I said, resemble fainting, sweating, paleness, loss of consciousness. But some of the telltale signs of anaphylaxis are those allergic type symptoms. People may complain of itchy skin, scratchy throat, swollen tongue, those sorts of things. We have to make sure that we're aware of those situations. So when you are working in the aftercare area, if you see someone having difficulty, make sure you're asking the right questions. You know, are you having any itchiness? Is your throat swelling up or anything like that? If at any point we think an allergic reaction is starting, it's important that you let the clinic managers know right away. Okay? But we have seen some people start off with what we thought might be turning into anaphylaxis. Someone who, you know, my throat's getting a little bit swollen, I have a scratchy throat, I've got a rash on my arm. It doesn't always progress, thank goodness, to anaphylaxis, but we have had a couple situations where the supervisors have had to be notified, and we just have to keep a closer eye on them. Okay? Although the management, I'm going to go through the management of anaphylaxis. For our purposes, the main thing is notify someone right away and follow instructions. That's really what we want you to do, and stay calm as much as you can. If you have the wherewithal to remember the time that the vaccine was administered or the time that the reaction started, that's always helpful. And again, like Kevin mentioned, if you do call 911 from campus, it is important that you let them know where you're calling from on campus, that you are calling from campus, and that campus protective services will need to be notified so that the EMS services can arrive promptly. Okay? But just a review of the treatment of anaphylaxis. The number one treatment for anaphylaxis, the most important thing to do is prompt administration of epinephrine, and we'll have injectable epinephrine on site. So whether that's an EpiPen that we may be comfortable using, or whether it's injectable epinephrine that's drawn out of an ampule, we'll have that on site. 911 needs to be called. We need to start that process so that they can get help right away. We can also reduce the allergic reaction by administering antihistamines. Something like Benadryl or diphenhydramine can be given either orally, or if they're unconscious or losing consciousness, by intramuscular injection. If they're comfortable and they want to lay down, that's fine. Some people who have that swelling of the throat or tightening of the chest don't want to have any extra weight on their chest, so they might want to stay upright. Whatever way they're comfortable, just make them comfortable until help arrives. And if the need should arise, CPR may need to be performed, chest compressions and that kind of stuff. Okay? There isn't a lot we can do to prevent anaphylaxis once it's started, other than the treatment that I just mentioned. But in our pre-screening, that's the prevention. That's where prevention of anaphylaxis happens. That's where we ask any previous history of allergies, egg allergies, previous reactions with the vaccine. As well, the 15-minute wait is a way to prevent anaphylaxis from going untreated if they happen to have a reaction where they're away from medical care. All right, oculo-respiratory syndrome. I mentioned it earlier. This is where we're going to go into a bit more detail as far as what it is. Oculo-respiratory syndrome is a series of symptoms that affect usually the airway as well as your face. It usually happens within 24 hours of vaccination. It's been associated with certain years of vaccine. There's been some years where there's been a higher incidence of it, and certain lots of vaccine in other years as well. So that's why there has been an association with the influenza vaccine, so we do ask about it. The signs and symptoms of ORS are bilateral red eyes, so red watery eyes, and or they may have some respiratory symptoms as well, so cough, chest tightness, wheezing, swollen throat, difficulty swallowing, hoarseness, and or facial swelling. So three main series, itchy watery eye, or three main symptoms: itchy watery eyes, respiratory syndrome, and possibly facial swelling. Okay? If they have had oculo-respiratory syndrome after past influenza vaccination, we're going to follow that flow chart, and we determine that in the screening process to make sure that the vaccine is going to be safe for these guys to receive. The fourth reaction is Guillain-Barré syndrome, or GBS. One thing I need to mention about ORS, or oculo-respiratory syndrome, it's self-limiting, it's rare, and it's usually mild. Okay, so although the symptoms can be unpleasant, they might make your face puffy and your eyes red, most people can still go about their normal daily activities. They can go to school, go to work, and that kind of stuff, and it will go away usually within a day or two, and it happens within a day of the vaccine. Guillain-Barré syndrome, again, is rare and self-limiting. It usually will go away on its own. Sometimes it can take a little bit longer. Sometimes it can last months. Its effects can last months, but it is self-limiting. It is described as self-limiting anyway. Guillain-Barré syndrome is associated with various triggers. We actually don't know all of them. We do think that it is associated with infections. There's a baseline incidence amongst the general population for Guillain-Barré syndrome. So aside from influenza vaccination, it happens, there's approximately 2 cases per 100,000 person years. And like I said, it's thought to be triggered by an infection or some sort of trauma to the body. A common infection that it's been linked to is Campylobacter jejuni bacterial infection, but it's also been linked to, in previous years, influenza vaccination, certain viral infections as well. In 1976, there was a swine flu influenza vaccine, which was associated with an increased risk of GBS, but that link has not been established with more recent types of influenza vaccine. But we tell them that the baseline is 2 cases per 100,000 person years, and it's thought that the influenza vaccine may increase their risk by up to 1 extra case per every 1 million doses of vaccine given, so literally 1 in a million. Okay? So very, very rare and very unlikely. However, as part of informed consent, we do need to inform them of GBS, let them know the signs and symptoms. So the signs and symptoms of GBS, it is a symptom or syndrome that affects the nervous system, primarily the legs. Usually it includes loss of reflexes, weakness, tingling, or numbness. It can lead to partial or full paralysis. Again, rare and self-limiting. It does go away. And if they have been diagnosed with GBS within 6 weeks of a previous influenza vaccine, the vaccine is contraindicated for them. Okay? Any questions on possible reaction to the vaccine? Okay. We're going to take a quick break, and then Beth is going to take over and talk about recording of vaccination. So how long?
Maybe 5 minutes?
5 minutes?
Everybody get up, stretch. Those of you who are starting to fall asleep, shake it out. One of our registered nurses from University Wellness Services from the health center.
Okay. Can you guys all hear me in the back? Yes? Good? Okay. So I'm going to talk to you guys a little bit about my favorite subject, which is documentation. Now that might seem a little bit weird to you guys, but I'm very passionate about proper documentation. At the end of the day, I'm the one who sees all of your charting, and I've seen some very creative and interesting forms of charting over the years, so I'm hoping that by the end of the presentation today, you'll feel confident to be able to accurately complete the form. So, when you are giving the vaccine to a client, each and every single person that you vaccinate, you'll be providing with an immunization record. Now, in the influenza bubble, or world as I call it, that document is called the NCR. Now, there is an example in your packages of the exact form that you'll be using on the day of, and then Kevin's got kind of a smaller version on the screen up here as well. So this form comes as a triplicate form, which means there's three of each of these sheets kind of stuck together on one side. There's a white copy on top, a yellow copy in the middle, and a pink copy on the bottom. All you have to do to fill it out is to write on top on the white copy, and your pen pressure will push through the layers of sheets so that you only have to document once. After you've finished documenting on the form, you're going to tear off the back sheet, which this year is pink in color. The client takes that with them as their permanent record, and the white sheet and the yellow sheet stay with you, and you'll be handing them in to either Erin or myself throughout the day. If you take a closer look at the form, the top of the form there, that first top trunk, is just demographic information about the client. So their name, address, date of birth, healthcare number. They'll be filling that in themselves, so you guys don't have to worry about anything for that very top portion. So they'll be doing that at the registration table, and then when they come to you for their vaccine, they'll hand that to you already completed. The middle portion is your portion. It's your responsibility to fill this part out. And it starts with that little checkbox right beside informed consent. This is very important that you check this off for every single client that you see. This is the most missed part on the NCR form that I see that students do every single year. It's small and it's kind of squished in between all the other information, but please don't forget to check this. If you don't check it, you can't prove that you gave informed consent to clients before you gave them the vaccine. Right underneath that, there's a list of reason codes. Now, reason codes, we're using these to collect statistics to figure out which groups of populations are coming to see us for flu vaccine this year. There's a number of them, if you look at them closely, that will not apply to our particular population. So we're not vaccinating children, so you can ignore those reason codes. We're also not obviously vaccinating residents of long-term care, so those reason codes don't apply as well. The ones that will apply, that you might come see clients coming through for, are number 44, the long-term care staff. Last year, I think we had maybe three people out of all 5,000 doses that fit into this category. People that fit into this category work in long-term care facilities that provide nursing care on a 24 hours a day, 7 days a week basis. So they're nursing homes, not assisted living facilities. So if someone works in those facilities, you can check this off as why they're here for the vaccine today. You will be selecting one reason code per client, all right? And then you'll see this, the box beside it, it says AHS Covenant Health Employee. If they are employed by AHS or Covenant Health, make sure you also check that box. The next one that you'll be seeing quite a bit of is number 3, healthcare worker. Obviously, everybody in this room is considered a healthcare worker, so that would be the code that you would be picking for yourself. Anybody that works in a hospital or a healthcare facility basically falls into this category. And this also includes people like unit clerks, porters, lab technicians, dietary aides, housekeepers, anybody in the health facility that has contact with clients within about a distance of a meter would be considered a healthcare worker, and that's the code that you're going to select for them. And again, if they're an AHS employee or a Covenant Health employee, you're going to select that box as well. Number 46, obviously, like Erin mentioned, we will be seeing pregnant women. This does mean currently pregnant, not trying to get pregnant, or if they've had a miscarriage or they disclosed some sort of information about that, they have to be currently pregnant, and it does not include breastfeeding. You can skip all the way down now to number 2, 65 years of age. Believe it or not, there are some older people that do work at the university, and they come for their flu vaccine annually, so you'll be selecting this code for them. And then down to 01B, high risk, 9 years and up to 17 years of age. Like Erin mentioned, we do have some 17-year-old first-year university students that might come to the clinic. So just make sure you're paying attention to their date of birth. That will be on the NCR, or you can ask them how old they are. Now, when we're talking about high risk, these are people that are high risk for complications to influenza. Now, Erin pretty much covered this earlier, but I'll go through some examples. So these are people that you're looking at who have chronic cardiac conditions like hypertension, who've had a previous heart attack, chronic respiratory conditions like asthma, COPD, people who are immunosuppressed, so they're either pre or post-transplant, they've had bone marrow transplants, people with renal disease. Also, other people kind of that group into this category, people with alcoholism, cerebral palsy, rheumatoid arthritis, Crohn's disease, chronic fatigue syndrome, fibromyalgia. There's another interesting kind of group of people in this category, and they're people living in chronically disadvantaged situations, so people who are homeless or living with no fixed address or are living in shelters. And there's 2 new groups of people that are in this category this year, and those are people who are Aboriginal and people who are morbidly obese. Now, in order to check this category off for people who are high risk, the client actually has to disclose that they have a health condition or that they are Aboriginal or that they are obese in order to be able to check off this box. So you can't just go by a nursing or a pharmacist assessment and look at the client and say, okay, I think this person is high risk, so I'm going to check the high risk box. Keep in mind that you will be presenting a copy of the form that you're filling out to the client. So if they tell you that they're healthy, but you've marked off high risk, there might be a little bit of confusion happening. So you have to have the client say, I am of Aboriginal descent, or I have a health condition related to my obesity, or I have asthma, or something like that in order to select this category. Is that clear to everybody? Does anybody have any questions? No? Okay. Moving on to 01C, high risk, 18 to 64 years of age. It's the same as the 01B, just the higher age category. And then 59B, healthy, 9 to 17 years old, and healthy, 18 to 64 years old. That's going to be a very popular one to select as well. Now, oftentimes we see people that fit into multiple reason code categories. So in order to make a decision as to which one you're going to select, you're going to start at the top of the list and look and work your way down, and the first code that applies to your client is the one that you're going to pick. So for example, if I tell you that I'm a nursing student and I also have asthma, what code would you guys pick for me? Healthcare worker, yes, exactly. So it's the one that's the closest to the top of the list. What about if I say I work at the Yuva home in St. Albert, I'm a long-term care worker and I'm also pregnant. Which one would you pick in that case? Long-term care, yeah, you guys got it, that's okay. Any questions about reason codes at all? No? Okay. So we're going to move over to the other side on what would be my left, your right. So for the dose, we're always going to select the annual box. So adults only get 1 seasonal influenza every year. The other boxes are left for children, so we won't be selecting them. Below that, we're always going to be marking off flu viral. That's the name of the brand name of the vaccine that we'll be giving, and there's only the one type of the vaccine available to us, so that's the one we're going to use for the whole clinic. And they've nicely already filled in the dose and the route of administration, IM, and then they've left you lot number and a blank, so you'll be handwriting in the lot number in that blank there. Below that, 99% of the time we're going to be giving the vaccine in the arm, and so you're going to either select left or right. You may have to give the vaccine in the left, or in the leg, I should say, and there's spaces there for you there as well. Intranasal will obviously, as Erin mentioned, that's the flu mist, which is the nasal spray, and we don't have that vaccine, so that one we will not select. You can skip right over below it, the children requiring a second dose. That one we can skip. And below that, you'll see a spot for pneumococcal polysaccharide vaccine. That one is going to be offered through the Alberta Health Services public health clinics and not through our location, so you don't have to worry about that. Below that, the immunizer's name. Yep, there we go. You're going to write your name in there. Please write legibly, and then beside that, your signature you're going to sign. And then follow that with whatever designation you're using. For nursing students, is it SN? SNNS? Something like that. Pharmacy students, I don't know what you guys are using, but sign and then put your designation behind it. Now, something new this year, at the very bottom of the form, is called the AHS Covenant Health Employee Information Immunization Record Only. If you've had someone who you've selected reason code number 44, long-term care staff worker or a healthcare worker, and they are an employee of either of those companies, they have the option of filling out this bottom part for you. You don't have to fill this out. You can pass them the pen. They can fill it out. They have to sign it, put their employee ID number on it, say where they work, if they've had a change in name and their position description. This is totally voluntary. They don't have to do it if they don't want to, but it is something that AHS is doing this year that's new. They want to collect data on their staff, so they want to know if there's an outbreak of influenza in a facility or on a specific unit. They can then go back and look at their staff's immunization records, and if you've been immunized, they know you're okay to work in that situation. If you haven't been immunized, they may need to make alternate arrangements for you. So this is completely voluntary. After this is all done, like I mentioned, there will be a pink sheet on the back. You just rip it off. On that pink sheet, they'll get a copy of everything that you've documented, and then if they flip it over, there will be aftercare information with HealthLink Alberta's number on there as well that they can take back with them. And then we keep the top two documents for our record purposes. Does anybody have any questions about documentation? Hey.
If someone were to present asking for a thimerosal free option from the just forward them on then to the public health.
Right. So the question was, if someone has come to the clinic and they're asking for a thimerosal-free vaccine, which is also known as Agriflu, we are going to be sending them over to public health because they have access to the vaccine. We only have FluMist for our clinic purposes. Anybody else? No? Okay. So I think Erin has a little bit of stuff to finish up with you, and then we're almost there.
Hi again. Okay, so we're almost done. Just a few more minutes. I appreciate your attention. Okay, so quickly want to go through what the day of the clinic is going to look like for you guys. Obviously, Kevin mentioned this is orientation part A. We're going to have orientation part B the morning of the clinic. So the clinic day orientation starts 2 hours prior to the clinic opening. At the clinic day orientation, you're going to meet up with your instructors. Some of you will know your instructors already. Pharmacy students will be meeting their instructors for the first time. Find out which group you're in and your schedule for the day. We will then be going through an intramuscular injection, the procedure. We'll review that. We'll do a demo and review informed consent again. And then after that's all done, we'll be doing a skills assessment and sign-off. And I believe the skills assessment and sign-off sheet has been given to you in the package, so you guys can look ahead to see what kind of stuff we're looking for in order to make sure that you're qualified to take part in the clinic. In the past, we used to do the sign. You may have talked to previous years or classmates or something like that that have taken part in this in the past, and they may say, yeah, it's awesome, you get to inject your classmates right off the bat. You will get a chance to inject your friends if you want to, or if your friends want you to. But we're going to start off by doing the skills assessment and sign off with people who are currently lined up to receive the vaccine. We'll just ask for volunteers to come in early because there likely will be a line before the clinic doors open. So you'll be dealing with real people, real patients, and either one of your instructors or one of the clinic supervisors will watch you and assess your technique and your informed consent and make sure that everything is being done correctly. And if you're signed off, you're good to go. Basically, you'll be working the rest of the day under indirect supervision as opposed to direct supervision, which I think is one of the advantages of this clinic. You do get to work without someone looking over your shoulder all the time. It just takes a little bit of pressure off the very first day that you're doing it. Makes it a bit more enjoyable, I think, for yourselves as well. So after the orientation, the clinic will open. So the clinic on the main campus clinics at Dinwiddie will open at 9 a.m. And the satellite clinics at Campus Saint Jean and Enterprise Square, the clinic doors open at 10. There will be a posted schedule when you arrive at the clinic on the clinic day. So I ask that you know where you're going and when you need to be there in order for the clinic to function and for there to be enough people administering vaccine and prevent lineups of people. We really have to make sure that when you're scheduled to be at the vaccination station, you're at the vaccination station so we don't have a backlog of people waiting. The patient flow, Kevin already showed you the diagram of the clinic. So the first step is registration or pre-care. And the Dinwiddie Clinic, that registration table is going to be downstairs in the main floor of sub so people can see it. It increases our foot traffic. From there, at that point, they'll fill out their registration and paperwork, and then they'll be directed up to Dinwiddie where they'll be waiting in the waiting area prior to administration. So there will be students downstairs in the registration area. There won't be any students posted in the pre-waiting area where they're waiting to be called to a vaccination station. And then obviously once the station becomes available, they'll be called to the vaccination station where you'll be spending a majority of your time. And then after that, they'll be going to the post-care, the 15-minute wait area after vaccination. You will get breaks during the day. We have a half-hour lunch that will be, half-hour lunch that's scheduled for you, and this year lunch and beverages will be provided to you. So lunch will be provided. You'll also get 2 15-minute coffee breaks. The coffee breaks need to be coordinated within your group. We want you to, you get a morning coffee break and an afternoon coffee break. We want you to time that during your time in pre or post care. So if you're scheduled in post care in the morning, half the group will go for the first 15 minutes for coffee break and the other half will stay and work. And then after 15 minutes, you'll swap, and the other half of the group will get their break, okay? So make sure if you are taking your coffee break, make it back in time so that your group mates can have their break as well. Just wanted to quickly review pre- and post-care expectations. I know Kevin already talked a little bit about it. We will be addressing the duties that you're responsible for at the vaccination station at the orientation the morning of the clinic, but I just want to take this opportunity to just reiterate what we want you to do when you're at the pre-care station and at the post-care station. So pre-care is also called registration. Again, will be located at the registration table, which will depend on which clinic you're working. You will be provided with screening questions at the registration station, okay? So we want to make sure that you are actively involved in talking to patients, making sure those screening questions are addressed. Again, that all comes down to their fitness to be immunized. So it's important that you approach patients and make sure that those screening questions are looked at. You're also going to be responsible for helping people with their paperwork. Beth just went through the NCR with you, and there is that one area where people are responsible for filling in their own demographic information. There might be some people wondering what their Alberta healthcare number is, and you can help them out with that. Obviously, you can't help them with the spelling of their name or anything like that, but you can make sure that they've written legibly. It is important that the form is filled out correctly and that it's readable. Okay. You'll also be working with University of Alberta Health Promotion and Wellness staff who've taken part in the clinic for the last few years, and they will be manning the registration tables. They'll be the ones that are tracking all the one-card swipes and stuff like that, making sure that we're just letting staff and students of the university in. Because they're getting pretty good at this, they'll be able to help you as well. If you have any questions, where should I go, what should I do, this person has asked this question and I don't know the answer to it, they're good resources for you, and we ask that you respect their direction and listen to them as well. In post-care, which is the 15-minute waiting area after the patient has received vaccination, you'll be stationed there as well for a portion of the day. And guidelines state that patients after receiving their influenza vaccination should wait in an observable area for 15 minutes. And the whole reason for that is to make sure that they're close by medical attention if they do have an adverse reaction that requires medical attention. We've already talked about some of the possible reactions: fainting, nausea, worst case scenario, anaphylaxis, those sorts of things. And also some people might think of questions after they've received the vaccine, if I forgot to tell you I'm on an antibiotic for an ear infection. Am I going to die now that I've had the flu shot? You know, people are going to be worried about that, you know, questions they forgot to ask, and you can address those. They're not going to die, by the way. So one other thing about the 15-minute wait area, that's a guideline and it's requested of them, but we cannot enforce them to stay. You are going to run into people who have to be at work, or they're late for a class, or the wait was a bit longer than they anticipated, and they're going to refuse to wait for 15 minutes. They might not wait at all. They might wait 5 minutes. The best we can do is just inform them the reason why we asked them to do that, and we just have to let them on their way if they insist on it. Okay. When you're working the post-care area, we want you to be paying close attention and observing the patients who are in that area. We've gone through some of the reactions and some of the symptoms of those reactions. We want you to be watching for those. Not everybody that's feeling unwell after vaccination is going to put their hand up and say, you know, I think I need help here. People will just suffer in silence. And so if you do see someone that isn't feeling well or looks like they're having difficulty, by all means, feel free to approach them and talk to them. Be available to answer the questions. We want you to take an active role in the pre and post care. It is a time of the day when what you're doing through the day when you're working at the vaccination stations is exciting and it's new and it's fun to talk to your classmates about that. But at the same time, when you're in the pre and post care areas, that's an opportunity to interact with patients. That's something that's important in our learning process as well. And it's a good opportunity to represent your profession as well. So we ask that you just play an active role and approach people. Just some final housekeeping items before we are done. Kevin already addressed this, but I can't say it enough. Be on time. Be early if you're worried about being late. The clinic day orientation is full of a lot of important, well, what we think is important information. Important enough so that if you miss it, you don't get to take part in the clinic. So if you are late and you miss one of those important portions of the pre-orientation, then you may be asked to leave and you may not be able to take part in that day of the clinic. We will not re-review orientation material for people who come late, okay? So as Kevin said, it's a good idea to know where you're going. If you're working at Enterprise Square and you've never been down to the downtown campus, it's probably a good idea to hop on the LRT one afternoon and find out what stop you're getting off and find out how to get from the LRT stop to the room that we're going to be in. And ahead of time, we can let the instructors know the rooms so that you can find them. Okay.
So just to be clear, the two pre-days, October 31st and November 1st, that's Enterprise Square and Cap Saint-Jean. The clinics are scheduled to run between 10 a.m. and 2 p.m. The time that we and you need to be there is 2 hours in advance. So you want to be there and ready to go by 8. That's when the orientation actually starts. At each of those sites is 8 o'clock. And after 2 o'clock, we'll take 30 minutes to tear down and get everything packed up. So plan to be there until 2:30. On the main campus days, clinic opens at 9, and it's going to run until 3, which means that you need to be there at 7, and we're going to be sticking around after 3 o'clock. Generally, it takes about half an hour or 40 minutes to get everything torn down and taken care of on the last day of the clinic on the Friday. Okay, so 2 hours in advance, 7 o'clock a.m. for the main campus clinics, 8 o'clock a.m. for the 2 extended campus clinics.
Okay. The next item is just a reminder not to bring valuables. We will have a place for you at all of those clinics to put your backpacks and your coats and that kind of stuff. But we don't want you to bring anything that you don't require that day that could be perceived as valuable or would be attractive to steal. Again, reminder to complete the Alberta Health Services workbook. What we've tried to do today is just give you a summary of some of the important aspects of that workbook, but we want you to read through the workbook. Just a couple more minutes, guys. Just a few more minutes, okay? Complete the workbook and do the self-test at the back of the workbook and bring the completed self-test with you to the day of the clinic, okay? Like I said, lunch and beverages for lunch will be provided, but bring a water bottle. You will be at the vaccination station and doing a lot of talking, so it's going to be nice to wet your whistle on occasion between patients. And the last thing is dress code. Okay, so pharmacy students will be wearing their white dispensing jacket together with their faculty identification badge. Is that right, Dr. Bond? Okay, and the name tag, yeah, with their name tag. And then the nursing students will be wearing scrubs, I believe, with their faculty identification badge as well. Okay, anyone have any questions? Question in the back?
with Alberta Health about that, about the possibility of getting some translated forms, and they were very specific that no, the forms will be in English, but the whole purpose of your presence and ability to provide some of that service in French is to make people feel more comfortable. In general, the majority of patients who will be coming through will be able to complete the form in English. We last year did have a couple patients where it was a great help just to be able to sort of reframe things in such a way that they can understand them in French.
So if our need to translate, then I'm guessing, like, my question is, like, we're giving the information in English?
Yeah. Yeah.
Last year, I had a really fun they all sort of did that process in French. So it was a great opportunity. And it was somewhere to but most of them were really great. I'm sure it's not anything where we can not
That answer your question? Okay.
Would it be of value to have all students as part of a project maybe translate the document and that can be a project?
Hello. So yeah, with regards to Campus Saint-Jean, we actually asked that very question. As a part of that, and as well, Michener Park is another site that we're actually partnering with Alberta Health on this year, and Michener Park is an international residence, so I had approached them about that. Unfortunately, they've been very specific that we cannot in any way change the form or translate it or do anything that's going to change it. So it's something that we've suggested to them for future years, that they consider translating it, at least into French, given that we do the Campus Saint-Jean clinic.
Sorry, I wasn't clear in my question. I didn't mean the form that we would show to the client. I meant the form that the students would read. So if they're doing their teaching in French, so it's
Right.
consistent.
So the prompts. Right.
Yeah.
Yeah. Absolutely something that we could look into to provide the prompts. The main thing is making sure at the end of the day that what's translated still is going to make sense at the end of the day and isn't so far off the path that it actually is conveying different information. So, but yeah, it's a great idea. Other questions? Okay, we are going to be here for the next 20 minutes or so. So if you have specific questions, feel free to come and see us. Thank you so much.